So this chapter is, or this unit is Unit 16. It's about antifungal, antiviral, and immunizing agents. First, let's talk about viruses. Viruses are parasitic minute organisms that may invade normal cells. They depend on the invaded cells for nutrition, metabolism, and reproduction. To date, over 300 viruses have been isolated from animal hosts. Many of these viruses are considered to be harmless, yet others are the cause of approximately half of all infectious disease. The common cold, coryza virus, smallpox, yellow fever, most childhood diseases, herpes, influenza, Epstein-Barr syndrome, rabies, hepatitis B, HIV, human deficiency virus, and AIDS, acquired immunodeficiency syndrome are virus related to infections. Fungi are plant-like organisms that also depend on a host for their existence. These organisms, which include mold, yeast, and be parasitic or grow in dead and decaying organic matter. Many forms of fungi are pathogenic to plants, animals, causing such diseases as histoplasmosis that can be transmitted by cats, for example, candida infections, cryptococcosis, athlete's foot, and tinea. The immune system is the body's defense mechanism against viruses, fungi, bacteria, and other foreign substances. Known collectively as antigens, these foreign substances, when detected, are the targets of a number of specialized cells that are activated in response to their presence. Simply stated, there are 4 general phases associated with the body's immune response to a foreign substance. Number 1 is, as you can see here, the recognition of the enemy or foreign substance. Number 2, amplification of the body's defenses with the white blood cells. You have the phagocytes that are cell eater, especially macrophages. In phagocytosis, white blood cells ingest or engulf other cells, bacteria, or foreign particles. You have also the lymphocyte, T cells, and B cells. The helper T cells, lymphocytes T, are the commander-in-chief. They identify the enemy and rush to the spleen and lymph nodes, where they stimulate the production of other cells to aid in the fight of the infection. The killer T cells, lymphocytes, specialize in killing cells of the body that have been invaded by foreign substances. They also fight cells that have turned cancerous. B cells are the biologic arms factory, the B lymphocytes. They reside in the spleen or lymph nodes and produce antibodies. Number 3, the attack phase, during which these defenders of the body seek to kill and remove the foreign invader. Number 4, the slowdown phase, that is during the number of defenders return to normal following victory over the foreign invader, if the disease don't kill the patient. Antifungal agents. Antifungal agents are synthetic drugs that destroy or inhibit the growth of fungi. They are also effective against yeast. Characteristic and uses in the actions, the antifungal agents act by exerting fungistic or fungicidal action on both resting and growing cells. They bind to certain esterols to the cell membrane, thus allowing leakage of essential intracellular compounds. which results in death of the cell. They are not effective against bacteria, rickettsia, or viruses. Antifungal agents, the uses of antifungal agents are used for systemic, skin, and mucous membrane fungal infections. Some diseases for which a physician may prescribe an antifungal are histoplasmosis, again, candida infections of the skin, mucous membrane, intestines, and vagina infections, cryptococcosis, athlete's foot, and tinea or ringworm infections. Let me mention to you
Good
some.
night, Professor. I'm sorry, I just saw the WhatsApp message.
No problem, no problem. We are just starting with the PowerPoint of chapter 16, antifungal, antiviral, and also immunizing agents
Okay,
and immunization. We talked already
okay.
about, well, we
You
started,
took attendance already?
yeah, I'm gonna put you present at the end, okay?
Okay, thank you, Professor.
Francesca Fortune. So we just talk about we are talking about antifungal agents. We still need to talk about antivirals and immunizing agents. So continuing with antifungal agents, this is medication for fungi. And now we are going to mention some of these medications so you get familiar with the names and the actions they have. Number one, let me mention to you clotrimazole, that you have heard maybe about it before. Clotrimazole, and a commercial name is Miselex, coming clean in cream, lotion, and ointment. Another medication, antifungal agent, is fluconazole, commercial name Diflucan. They are tablets of 200 milligrams for the first day and then 100 milligrams once a day for 2 or 4 weeks. It depends on the severity of the infection. Another medication is ketoconazole, commercial name Nisoral, comes in tablets of 200 milligrams, one tab, to 400 milligrams, that is two tab, once daily. For 1 or 2 weeks, it depends on the severity of the infection again. Another medication, antifungi, is terbinafine, Lamisil, that is oral, is for you can use it for fingernail onychomycosis, one 250 milligram tab once daily for 6 weeks. So it's a long treatment. Or you can have also for toenail onychomycosis, one 250 milligrams tab once daily for 12 weeks. So 12 weeks is like 3 months. So for toenail onychomycosis, that is difficult to get rid of it because of the humidity on the socks and the shoes. Um, that's why the treatment is so long. Let me tell you something about this type of medication, the antifungal medication, antifungal agents. And is something that you need to take care. I have mentioned this before, is the interaction with other medications. Your doctor needs to know what other medications you're taking because of the toxicity. Is a very strong medication, this antifungal medication, and also the toxicity that affects the liver and the kidneys. And also it's important that the doctor knows, or the gastroenterologist knows, if the level of your enzymes of the liver, to do a liver enzymes panel to know if the liver is okay. And another extra thing is that you cannot mix drinking alcohol with this medication. The alcohol potentiates the damage or toxicity that these medications can do to your liver and your kidneys. All right? So that's something key. Now we talk about antifungal agents. Now let's talk about antiviral agents. Antiviral agents are synthetic drugs developed to combat specific viral diseases like herpes simple viruses, herpes zoster, and are used for treatment and management, not a cure. Influenza is one virus that, and these antiviral agents are used for prevention and treatment, but only for prevention in children. Let me mention to you some antivirals. Antiviral agents, as I mentioned before, are synthetic drugs that have been developed to combat specific viral diseases. Viruses are responsible for many diseases, such as the common cold coryza, influenza, genital herpes, herpes zoster, and AIDS. In the United States, several antiviral drugs are employed in the treatment of specific diseases. The details on selected antiviral drugs is a different drug for every type of virus. For example, let me give you some examples of drugs, antivirals. One name that you need to get familiar with is acyclovir, commercial name Sovirax. In the actions of this medication, acyclovir has an in vitro inhibitory activity against herpes simplex, virus type 1 and type 2. Also works on varicella zoster, Epstein-Barr virus, and cytomegalovirus. It is used for treatment for initial episodes and the management of recurrent episodes of genital herpes in certain patients. It is not a cure for genital herpes, but it helps. Another medication that is good that you get familiar with, well, with that one is okay. With that example of antiviral, well, let me mention to you another one that is penciclovir or denavir. The actions have antiviral activity against herpes viruses type 1 and type 2. Penciclovir penetrates into the infected cells to block the multiplying of the virus that causes the cold sore. The uses are in adults. Penciclovir cream is indicated for the treatment of recurrent herpes labialis or cold sores. Now let's talk about another type of antiviral medications that are the neuraminidase inhibitors. These antivirals block the function of viral neuraminidase that are a biochemical component in the virus, commonly used as an antiviral for influenza. Examples of these medications are oseltamivir phosphate or Tamiflu, zanamivir or Relenza, laninamivir or Inavir, and peramivir. For example, let me mention the actions of this one, oseltamivir phosphate or Tamiflu. The actions, this medicine has antiviral activity against influenza viruses type A and B. The uses of this antiviral in adults, oseltamivir is indicated for the treatment of uncomplicated acute illness due to influenza infection for patients who have been symptomatic for no more than 2 days. Now let's talk about antiretroviral agents that are used to treat. This is another type of antiviral agent. So these ones are antiretroviral agents, another type of antivirus. Are used to treat HIV infection. You have 4 general classes of this antiretroviral, that is these 4 here. NRTIs that are nucleoside reverse transcriptase inhibitors. They interrupt the virus replication. for example in HIV, the NNRTIs that are the non-nucleoside reverse transcriptase inhibitors. They inhibit the HIV production. The PI that are protease inhibitors, PI, interrupt the last step of viral replication. And the FI that are the fusion entry inhibitors, they prevent HIV from entering the T cells. A combination of antiretroviral drugs, usually 3, is used for the treatment. So when an HIV patient have indicated of these 4, needs to have indicated 3 of them to be effective. This medication revolutionized the treatment of HIV, because when the disease of HIV was discovered in 1981, there was not a treatment for it. It was a pandemic that was taking so many lives. The hope of life was around, or the prognostic was like 5 to 10 years after being diagnosed. If you're diagnosed like in a stage, it depends on the stage that you were diagnosed. And this is an opportunistic infection, the HIV, because the HIV is, with the HIV, the patient gets a weaker immune system. So the patient can get any opportunistic bacteria, virus, or fungi that can kill the patient. For example, tuberculosis, pneumonia, or any gastroenteritis caused by Salmonella, Shigella, and some other infections that can kill the patient. Meningitis, for example. So there are some side effects for this medication, as any other medication. You gotta have a special considerations about antiretroviral agents. Like, the treatment does not cure HIV infection, but as I told you, this medication was discovered in the late 90s. So this medication brought a different life to HIV virus patients, because right now, because of this treatment, HIV virus patient can live like a normal life, like 80 years they can live like any other person. So this treatment is very important and very helpful for this type of patient. But you have special considerations, as I mentioned before. The virus may not be detectable after treatment, but is still present and may still be spread. A combination therapy is very expensive. The virus may rebound if the regimen is discontinued. HIV drugs may interact with other common drugs, prompt or worsen diabetes, cause weight redistribution, increased risk of stroke or heart attack. Interact with other common drugs, prompt or worsen diabetes, increased risk of stroke or heart attack. Now let's talk about, before talking about immunization, let me tell you something about HIV in babies and children. HIV in babies and children, much has been written about HIV and the adult, but what about the babies and children who have HIV? Facts about HIV in babies and children. HIV can be passed to a baby during pregnancy or delivery. An HIV-infected woman's chances of having a baby with HIV are 1 in 4, so 25% for each pregnancy. HIV can be passed to a baby through breast milk from an HIV-infected mother. Like adults, children and adolescents can get HIV from contact with blood or body fluids or through sex. Bathing, kissing, feeding, and playing with a child are not risky and do not cause the spread of HIV. In the past, some babies and children became infected through blood transfusions. Today, the blood from all donors is screened for the virus, and HIV infection from this source is unlikely. Special blood tests can show whether an infant is infected with HIV. The child with HIV needs to see a healthcare provider who has experience treating HIV-infected babies and children. Early immunizations can help protect the baby or child from other HIV-related diseases. Immunize against infection. Well, let's avoid that. Well, I think everything was said about HIV. Well, something important about HIV or something different is mother-to-child transmission. Antiretroviral drugs can be used to help prevent HIV being passed from a mother to her unborn child. The first antiretroviral drug used to prevent the transmission of HIV from mother to child was azithromycin. Used during pregnancy, this drug had a significant impact on this transmission. Mother to child transmission, also known as vertical transmission, may occur before birth, during birth, and after birth through breastfeeding. A woman can minimize the risk of HIV being passed to her child by certain interventions. These include taking antiretroviral drugs during pregnancy, excluding the first 3 or 4 months of pregnancy, taking antiretroviral drugs during labor, choosing cesarean section as method of delivery, giving the baby a short course of antiretroviral therapy after birth, abstaining from breastfeeding. Special considerations. 1 in 10 people with AIDS in 50 years of age or older, approximately 4% of all AIDS cases, are among those aged 65 or older. AIDS have been reported in more people who are 50 and older than in those 24 years old or younger. Incidence of AIDS among older adults appear to be rising faster than in younger age groups. Immune function diminishes with age, and AIDS infection usually progresses more quickly in older adults. HIV may be acquired at any age, and older adults become infected in the same ways that younger people do. Older adults are sexually active and usually do not use condoms because they are no longer concerned about pregnancy or contracting a sexually transmitted disease. Homosexuality and bisexuality may also be part of an older adult sexual preference. Intravenous drug use is a high risk factor in the older adult. Older adults may have contracted AIDS from blood transfusion. Screening of donated blood began in 1985 and has reduced the risk of contracting AIDS from a blood transfusion. Possible signs and symptoms of AIDS in older adults. HIV/AIDS dementia usually has a rapid onset. Extrapyramidal symptoms resembling Parkinsonism without resting tremors, ataxia, leg tremors, peripheral neuropathy to weakness and abnormal reflexes such as positive Babinski, confusion, opportunistic infections, tuberculosis, esophageal or recurrent genital candidiasis or toxoplasmosis, non-Hodgkin lymphoma, Kaposi sarcoma, pneumocystic carinae pneumonia (PCP), or human papilloma virus infection. For diagnosis, there are 3 tests that you can do that are ELISA, enzyme-like immunoabsorbing assay test result positive, or also Western blot test positive, and CD4 lymphocyte count of less than 200 cells. The normal is from 1,000 to 1,300 cells. So if you have less than 200 cells, it is possible that you are HIV positive. Something important that we need to review is immunization. Immunization involves an antigen antibody response. Immunization denotes inducing or providing immunity artificially. Active administration of vaccine or toxoid. passive temporary through administration of antitoxin or antibodies. Immunizing agents are vaccine, toxoid, immune globulin, specific immune globulin or antitoxin. Immunization schedules in infants, children, and adolescents. You have to follow. In the CDC is published all these protocols about vaccination. Implementation has greatly reduced the occurrence of vaccine preventable diseases. Hepatitis B vaccine needs to be applied in healthcare workers, military, morticians, prisoners, user of illicit drugs, people with risky sexual behavior. For immunization, I sent you already a video about a YouTube video about the part that talks about immunization. We don't have more time, so check the YouTube video that I sent you in the WhatsApp group about immunization, and also the other video about chapter 17, anti-neoplastic agents, that is medication for cancer.